topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, New York. From what I understand, it's cold New York. We're here in South Florida. Doesn't get that bad here, but have we got a great show for you this morning. We are right in the middle of Medicare open enrollment. And I got to tell you, we have gotten so many new listeners from this show based on what we're seeing on YouTube. And people really liked this show. Let me introduce you to Dan Alcorn of Alcorn and Associates. Good morning, Dan.
Good morning, Steve, and thank you so much for having us on this morning. Yes, as you can see in the background, it's white in New York. A little bit of snow getting us ready for the holidays. And as you pointed out, we are smack dab in the middle of the Medicare annual enrollment period, which began on October 15th, runs through December 7th. So this is a good time to pause and have a chat about what's going on nationwide and here in New York.
Hey, Dan, I wanted to save this for the show so I could get a spontaneous response from you. We had, after your last show, and a very big insurance company marketing director contacted us who listened to your show. And she wanted a show just like yours in New York, which you have all of New York. But she was so complimentary, Dan. And what's amazing is I've been doing this for 16 years. And usually when a competitor contacts us, they always put down our expert. It never fails. But just the fact that she said how good your show was, that they wanted one, I thought that was the most amazing compliment.
Well, that's great. Thank you for that compliment out there. Yes, our phone lines have been ringing. Our web traffic is soaring. Well, part in due to the exposure we're getting through you, Steve, but also there's 1 million people nationwide that are enrolled in Medicare Advantage plans that since our last show have received word that their plan is being discontinued. They've been directed to explore Medicare.gov and go through the dozens of options that are available. And it can be quite confusing and a little overwhelming. So they're calling on us, our team. As I mentioned in previous sessions, we have a group of independent licensed agents covering New York State. We don't work for the government. We're not employees of any particular company. So we try to find a plan that meets their doctors, their medications, and their budgets in their community. Healthcare is local. So yeah, we're very, very busy, and I'm glad to hear that wonderful feedback. We're seeing it in our offices as well.
Dan, before we get started, tell people about Alcorn and Associates.
Well, as I mentioned, we are a team of agents, licensed agents here in New York, based from the Canadian border to Long Island. We cover the entire state of New York. Each of us contract directly with different insurance companies. The nationals are well known. I say them alphabetically, Aetna, Blue Cross, Humana, United Healthcare, the like. But then we also work locally with some companies that may only service, say, the the Long Island, New Jersey area, or upstate, or the Buffalo region. Many of us are licensed in neighboring states like Vermont, New Hampshire, Massachusetts, New Jersey, but Florida as well. So we have a number of clients, and I know you have quite a few listeners from Florida.
Yes.
A lot of disruption in the market there as well. So we're independent, but we band together to help each other out. You know, I may be licensed in Florida, but my colleague is licensed in the Carolinas. And so we work with each other to help our clients find a plan that fits their doctors, their medications, their upcoming procedures in their local community. It's working very well. We've been doing this since 2011. And as I say, there's 7 of us. They're all listed on www.dgalcorn.com. You can see all of our names and what states we work in and companies we represent.
I want to say this, and I actually spoke about it last time. So I'm on Medicare. I made a lot of mistakes. There wasn't a show like this that I could learn from. It was very costly to me. But the one thing, Dan, that I absolutely must share with people is having a good agent, because my first agent I had was horrible, terrible. And I have learned from doing the show with you and our other shows around the country, and now seeing what a good agent can do for you. It is so important that, and that's why we're bringing you a show like this, is the importance of having a good agent. And Dan, you just said we're in the middle of enrollment. What is the Medicare annual enrollment period? When does it end?
So it began on October 15th and runs through December 7th. During that period, individuals in Medicare can choose or change their drug coverage, if it's just a standalone drug plan, or a Medicare Advantage plan. So yeah, that we see a lot of folks, you know, either their plan is being terminated or it no longer meets their needs. So there's that shopping and comparison time frame. Make a decision by December 7th, and your new plan will take effect January 1. That's the annual enrollment period just for Medicare.
What happens if I choose the wrong Medicare Advantage plan? Can I make a change anytime in 2026?
Depends on when and where. So nationwide, federal law, everybody who is enrolled in a Medicare Advantage plan, not to be confused with just original Medicare, but if you are enrolled in a Medicare Advantage plan during the first 3 months, January, February, and March, yes, you can choose to get out of that plan, say it doesn't work for me, I want to go back to original Medicare, and add either a supplement or a drug plan to that, or you could change over to a different Medicare Advantage plan. So the first 3 months, nationwide, everybody has that option. That's called the Medicare Advantage open enrollment period, or as some people distinguish AEP versus OEP. So actually, we could go through this whole dance again in the spring for people, but we try to, you know, find something that works for the foreseeable future so we don't have to have that change in the spring. In New York State, from April through December, there's a possibility you could change your plan if you belong to something called New York Epic. And it's a secondary drug program unique just to New York residents. But people who belong to that actually have an additional opportunity to change their plans. So some people could actually change their plan twice next year. And then, of course, in the autumn of 2026, we go through the annual enrollment period again for 2027.
Here's a great text we just got in from Kurt in White Plains. Thank you so much for bringing the show to us, Steve-O. I watch a lot of your different shows across the country. This is such an important show for me. I am 64 years old, And I understand that you waited too long. I don't want to get in that position. I really trust who your expert is today. Thank you so much. What is the difference between HMO and PPO plans?
Great question. Great question. In fact, we just had this conversation yesterday with a couple. They were looking to enroll in one and didn't understand the difference. So an HMO is a health plan. And by the way, this applies whether you're in Medicare or even in the open market for people before Medicare. And that stands for Health Maintenance Organization. What happens with an HMO is that you are required to see providers, doctors, specialists, and hospitals that have a contract with your health plan. Now, emergency and urgent care is an exception to that. You are, quote, in network in an emergency anywhere. But with an HMO, generally speaking, your costs, your premiums, and your cost sharing is lower, but your access to care is restricted. You have to see those providers who are in that network. With a PPO, as it relates to Medicare, you can see any provider or hospital that accepts Medicare in the United States, Guam, Puerto Rico, or the U.S. Virgin Islands. And if they accept Medicare, the difference then is whether they're a preferred provider, that's the PP and PPO, or just a regular Medicare providing participant. That's where you see on a column of in-network versus out-of-network. Some people think out-of-network means you don't have coverage. That's not the case. With a PPO, the in-network with the preferred providers, your costs are lower. And when you're out-of-network, you're still covered. It's just your costs are at a higher level. So I wish they called it preferred and standard versus in and out of network. Whereas with an HMO, Steve, great question from White Plains. If they're not in the not in the network, there's no in or out of network. You're covered or you're not.
Yes, it's, I got to tell you this. I think this will make some sense to you. This is one of the reasons why it's so important to have a good agent is I enrolled in a plan and I wanted to make sure that my orthopedic surgeon was part of my plan.
Mm-hmm.
And they said they're in the Humana plan. But then when I needed this orthopedic surgeon, of course, I have to go through my provider. They weren't in that group, Dan.
Mm-hmm.
I said, but I'm looking at it right now. It says they are. They said, well, we have a separate group that we kind of put our own plan together. And I was like, you know what? If I'd have had a good agent, he would have known something like that.
So yesterday, it's a great example, Steve. Yesterday, I was working with a couple up near the Canadian border, and there's a health plan up there that works with this particular health system. But the health system doesn't contract with every plan. So you not only have to ask, well, do you work with this company? So does the health provider, the hospital in that case, participate in every plan? Some of these companies offer 40 different plans, from employer groups to on individual market to Medicare. There's Medicare HMO and Medicare PPO. So your point is exactly, we need to confirm with our clients which the plan that they are considering from the company that they're considering, does it actually work with each and every one of their providers? Now, if it's a PPO, we can say, yes, they are a preferred provider with this plan or not. That detail is something we need to go over with each and every customer and client on a case-by-case basis, because everyone's situation is absolutely individual and unique. Down in the Poughkeepsie area in New York, there's IBM and there's major employers who will sign employer contracts with these carriers. Let's just say Humana, for example. I don't know that, but Humana may have signed an employer contract to manage the IBM employees and maybe even their retirees, but they may or may not have a contract with the local hospital for Medicare Advantage clients, but they may also have a Medicare supplement. It can be crazy. That's why you're exactly right. You need not just an agent, but one who's local, aware of the local situation, and has been around a while. You know, there's that television ad for the auto insurance company that says, we know a thing or two because we've seen a thing or two. Working with the hundreds of clients that we've worked with over the years, you know, we're aware of situations like you're describing and have to just keep that in mind on each and every client. Great example. Thanks, Steve.
Yeah. Cindy in Brooklyn wants to know, and by the way, thanks everybody for your questions, really good questions.
Yes.
She wants to know if I have medical insurance through my company, do I still need to sign up with Medicare?
Great question. We're asked that a lot. It depends on the size of the company. There's something called small group and large group. So when you turn 65, you have choices. You can either enroll in Medicare because the eligibility is to be 65, having contributed to Medicare over 40 quarters. And if you're employed, and your employer is what they call large group, that's 20 or more employees, and that employer's plan is considered creditable for both healthcare and prescription drug coverage, you are not required to enroll in Medicare. I would advise, though, if you're going to stay with an employer plan and work beyond your 65th to 70th, however long you work, keep the paperwork that the employer provides you where they show that their plan is or is not considered creditable, because when you do enroll in Medicare later on, you will be asked to provide proof that you had that coverage or otherwise face what's called a late enrollment penalty. You don't have to enroll in Medicare, but keep that paperwork.
Okay. How are the New York rules different from enrolling in a Medicare supplement plan?
So supplement plan, and I hope we'll come back in December and we'll talk about those in detail because there's really great stuff there. But supplement plans the rules are established nationwide, but they're regulated on a statewide basis. It's kind of interesting. But in New York State, unlike many of the other states I work in, New York has what's called continuous open enrollment, which means this Medicare annual enrollment period does not apply to the supplement plans. You can enroll at any time. In New York State, there is no underwriting. It's called guaranteed issue. You're guaranteed approved. Whereas in other states, your underwriting is waived only for the first 6 months following your 65th birthday. And in New York, it's called community rating, meaning that your premium isn't based on your gender, your age, or whether or not your health conditions, or whether you're a smoker. Is community rated. Now the communities are, Metro New York is one region, and upstate is another region, and the Buffalo area is a third. But that is very different than in other states. So we have situations throughout the year where people may choose to leave their Medicare Advantage plan and enroll in a supplement plan mid-year. When we come back in December, because we're in the middle of the annual enrollment period now, I would love our listeners to dial in and listen to what we have to say about the high deductible Medicare supplement plans. They're very attractive.
I gotta read this. We just got a text from a gentleman who he doesn't want to say. He's the VP of a health insurance company, listening to your show, and he basically is saying, I want to thank you for educating people out there, because there's so many people who don't understand Medicare. And I'm glad you're an independent agent, but I just want to tell people that you're really giving good information. What a nice text. You never know who's listening, Dan.
You're absolutely right. And we don't, I mean, we look at our team and say all our role is to try to uncomplicate the complicated, to try to digest all these gobbledygook that the government and the insurance companies are required to put into 48-page documents and translate it into English and things that folks can understand. We don't look at ourselves as salespeople, but rather advisors. You know, someone will say, well, what do you think I should enroll in? I said, our role is to digest all this and present the plans to you, you know, the Medicare beneficiary, understanding the differences between them all, difference between an HMO and a PPO, the differences in cost sharing, the differences in exposure or access to care, and then step back and allow you to think that through as to which factors are more or less important to you. And then we assist with the enrollment process and stay in touch. Our group is not a one-time enrollment. You know, you dial 1-800 wherever, you'll get enrolled, and it may take less time, but we'll be with you for the remainder of the year. And some of my clients go back, 10 or more years. That's great.
Dan,
great comment. Thank you.
How do people reach your office?
So right now, our best way to reach us is through our website, www.dgalcorn.com. Each of our agents has an online calendar where you can get right on to their own calendar, schedule a no obligation 30-minute consultation. Our office line is area code 518-346-2115. I will say we're scheduling out now just before Thanksgiving because we're in the middle of the annual enrollment period. But through the web, we respond to those, and we have a team of receptionists answering our phone and booking appointments. 518-346-2115.
And the name of the company is Alcorn and Associates. Dan will be back again with us next month. You can go back and actually watch the show on YouTube under Choosing a Medicare Plan New York. Dan, I cannot thank you enough. Great calls today, and we will see you next month.
Thank you so much, Steve, and happy AEP, and we'll see you in December. All right.
Hey, have a wonderful Thanksgiving, Dan.
Thank you, sir, and to all the listeners as well. Bye-bye now.
We're gonna go to a break. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.